A lot of talk today, just one day after we learned former President Joe Biden is battling metastatic prostate cancer. More and more men are being diagnosed with more advanced prostate cancer, according to the American Cancer Society. Our Michael George tells us even for patients with the aggressive disease, treatment options are still available.
The office of former President Joe Biden says his prostate cancer was graded with a Gleason score of 9 out of 10, representing a more aggressive form of the disease. And the cancer is spread to the bone. Prostate cancer surgeon Dr. Vipul Patel is not involved in Biden's care.
When a cancer spreads to the bones, it's defined as being metastatic disease. We don't know how effective that is in terms of how many bone lesions he has, so we don't know the extent of that. But what we do know is that that makes it a very aggressive form of cancer.
More than 313,000 new cases of prostate cancer will be diagnosed in the U.S. this year, and more than 35,000 men will die, according to the American Cancer Society. While aggressive, Biden's cancer appears to be hormone sensitive. Some good news, according to Dr. Celine Gounder, CBS News medical contributor and editor-at-large for public health at KFF.
Testosterone fuels the growth of the prostate cancer. So if you can block the testosterone, you're blocking the growth. And that is a very good prognostic indicator.
Dr. Patel says the prognosis for prostate cancer today is much better, even for patients with advanced disease.
Many of the medical therapies are quite effective these days and give patients longevity, even at 82 with high-risk prostate cancer. Depends how sensitive this cancer is genetically to the treatment they give him. But the nice thing is we do have many different types of medical therapy we can use today.
The president and his family are said to be reviewing treatment options with his physicians. Michael George, CBS News, New York.
Joining me now, Dr. Florian Stoey, a urologist and director of men's health services for Cook County Health. Doctor, thanks for the time. Let me just start with your reaction yesterday when you heard about this. This is a diagnosis I'm sure you're familiar with. What was your reaction?
I have to say, not knowing his full medical chart, not having reviewed any of this, and just seeing what's available to the public, it's hard to really know the processes that took place, when things happened, how things progressed. And so I have to say, I am a little reserved to say that, surprising, yes, but it can vary on many, many levels as to how things progressed in the past time frame.
You mentioned surprising because it surprised me, I guess. Really, the only two ways men know this and the way to detect it is through symptoms, which the president apparently had, or the PSA test. And my question is, he had the symptoms. Wouldn't the PSA test have picked this up a little earlier?
It's possible. One of the things that we always try to separate in our minds here is we know folks as we get older, prostate symptoms tend to become very prevalent. But we have to be very careful and understand that as we get older and the prostate grows and grows and symptoms start arising and presenting themselves, that may not necessarily be a prostate cancer symptom. Oftentimes what you'd see is what we refer to as a benign prostatic hyperplasia, where the number of cells increase in the prostate. And so it really boils down to having a process in place and a screening criteria to really differentiate, hey, is this a symptom of a prostate that's getting older, and as men get older, we know that that's quite common, or is this something different entirely, and do we need to evaluate for possible malignancy?
What do people need to know about the PSA test, doctor? Because there have been reports in the past that it's not necessarily, I don't want to say accurate because I don't want to talk men out of getting this thing, but it can lead to a lot of false positives. Is that right?
It's possible. I have to say, in terms of the biomarkers, PSA, prostate-specific antigen, is a biomarker. In fact, it's one of the best biomarkers we've ever developed and designed, and that we use on a day-to-day practice. And really, the best way to screen men is with this PSA. We recommend that we generally start doing that between the ages of 45 to 50, and it's something that encouraging men to connect with their primary care doctor, connect with their urologist, to have these conversations and decide a screening algorithm that works for them is prudent.
Dr. Stoey, thank you so much for your time. We appreciate your insight.
It's a pleasure. Thank you for having me.